Namaskar. Welcome to Dialogue with Divakars. This is Dr. Hema Divakar, a senior consultant, obstetrician and gynaecologist from the Divakar Specialty Hospital, JP Nagar, Bengaluru. We speak about creating awareness about the cancer of your womb or the uterus. Uterus, as you know, is a very important organ, primarily for holding and carrying through your precious pregnancies in your reproductive years. Well, when you reach the menopausal age, that is when you cross the age of 40 or 45, and your hormones, especially the estrogen hormones, create havoc in the inner lining of your uterus, they can trigger off excess growth of the inner lining, which gives rise to a bizarre pattern of bleeding. Many women in this age group think that this is common to have excess bleeding. It's quite common to have irregular bleeding pattern because this is what they expect at menopause. Well, you must seek help from your gynecologist because, of course, we agree that it could be an irregularity due to issues related to your hormones and menopause, but it could also be in rare occasions because the hormones are now triggering off the growth of your endometrium or the inner lining of the uterus, provoking a situation of uterine or endometrial cancer. The doctor will be able to tap your history, to do an examination, to do an ultrasound scan, to take a biopsy from your endometrium, just like how you test the blood, whether to find out it's typhoid or malaria or dengue or what is the origin of this fever. The same way the doctor will take a small piece from the inner lining of the uterus, subjected to the laboratory testing to check out whether this is a menopausal excess bleed or this is the situation due to endometrial cancer. Further on, they can offer a definitive treatment, which most often translates into removing your womb or the uterus, that is the surgical procedure of a hysterectomy, which will then guarantee you quality of life for many decades to come. So please do not hesitate to seek help and consultation from your doctor if you are in the age group of 40 plus and having an abnormal irregular pattern in your menstrual bleed.